Welcome to the MamasteFit podcast. In this episode, we're going to be talking about the importance of scar mobilization after birth to help you understand why you want to mobilize your scar, how you can approach mobilizing your scar, and even some signs and symptoms that you want to start mobilizing. Welcome to the MamasteFit podcast. This is Gina, perinatal fitness trainer and birth doula.
And I'm Roxanne, labor and delivery nurse and student midwife.
And this is the MamasteFit podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable, because pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experience as mothers navigating this stage in our lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We are glad to have you with us on this journey and that you have chosen us to support you.
So in this podcast episode, we've got Casey here, who is our C-section expert, and she's a physical therapist. We're really excited to chat with her all about the importance of scar mobilization after having a cesarean birth. Casey teaches our C-section scar mobilization webinar and our C-section scar course, in addition to our yoga classes. So this is going to be a really wonderful conversation on why it's so important to approach recovery after you have a cesarean birth, because it is different than having a vaginal birth. Still totally valid and a wonderful way to give birth, but we do have to approach the recovery a little bit different because there are some additional things that are happening. But before we dive into this week's episode, I need to share that our book, Training for Two, is now available for pre-order on Amazon. So you can go to the link in the show notes to grab your copy of the book. It comes out in September. If you're wanting to know how you use prenatal fitness to support a strong pregnancy, a pain-free pregnancy, it's going to include tons of modifications so that you can continue to lift throughout your pregnancy as well. Plus, we're going to go over how you can use exercise to help you prepare for birth, in addition to preparing for a cesarean birth. And we're going to go over early postpartum recovery as well, which does include some C-section recovery as well. So if you want to check out our pre-order, head down to the show notes below to grab the link and grab a copy of the book. So thanks so much for being here, Casey.
Thanks for having me.
Can you just introduce yourself to our listeners in case they don't remember you from previous episodes that you've been on and or the courses that you teach for us?
Sure. I'm Casey Backus. I'm a physical therapist and a yoga instructor and have been a part of MamasteFit really since the early days as a client, and then just kind of alongside Gina and Roxanne with C-section recovery after my first birth and then preparing for a second birth. So super excited to share what we've learned along the way, what we know from science, and all the good stuff.
So there's a lot of importance to mobilizing your scar after you have a cesarean birth. So Casey, could you just talk about kind of the anatomy of what is going on with a C-section surgery? It's not necessarily like all the nitty gritty of it, but kind of like what layers are they cutting through and how does that impact somebody after birth?
Yeah, it's a big surgery, and that's something that maybe is not as commonly known as it would be for maybe a knee surgery or a hip surgery. It's a sensitive area, and we're working with skin, we're working with fat, connective tissue, which is, kind of the spider webby fascia that we hear so much about, muscles, and then into the abdominal cavity, which, it gets pretty involved. And then inside the uterus. So all of those layers are open to get baby out and then closed up and healing kind of alongside one another, but mobilization can really help optimize the outcome.
So what's the first thing that somebody can do after they have a cesarean birth in regards to like helping their scar heal?
One of the first things that I will share with moms after cesarean birth is just to practice standing up straight. That's one of the most difficult things to do after cesarean birth. There's this contraction, this kind of like, we'll say, you may have known you were having a cesarean, or it may have been relatively planned, but your body kind of shrinks into this kind of protective contraction. And it can be like a physical thing, like, ow, it kind of hurts, and I'm just contracting because I don't want to pull. It can be a fear thing, like, I don't really know what's going on down there, and I don't want to stretch, or that's what I hear most commonly is like, I don't want to hurt it. And so I have taught many people just to practice standing up straight and just like take some breaths in that standing upright, because you will feel some pulling and tugging like right off the bat. You know, Roxanne, you know this well from working in labor and delivery, but some of that pulling and sticking is just the dressing that's on there. But even that sensation is like your brain's like, what's going on here? Like, let's go to a place where we're not really feeling that. So, yep, standing up straight, taking deep breaths, doing some walking. Like those are some of the basic things in the hospital that you can really start doing that, you know, are pretty low risk, high reward.
So Roxanne, as a labor and delivery nurse, what could somebody expect, like in regards to how like the medical team is going to support their healing, like immediately after their cesarean birth?
So immediately after the C-section, they're going to be moved to like a post-anesthesia care unit, so like a recovery unit, whether that's like a whole separate unit. So some hospitals, like you go to like the main OR for the surgery and you recover in like where everybody post-surgery is recovering. So you have somebody who got like their appendix taken out, their leg surgery, arm surgery, all in the same area, and then you and your baby are just in another bay. But most hospitals have it where you are on the labor and delivery unit, again, either in like a specific bay of like surgery, like where all of the post-C-sections are, or you go back to your labor room. So like in the hospital that Casey delivered at, I know she went back to the labor room after her C-section, and that's where she recovered. And we monitor you a little bit closer than we would after a vaginal birth because you did just have one major abdominal surgery, as well as the medications that you got are a little bit different than after a vaginal birth. So we want to make sure that the medications aren't affecting you, your heart rate's doing fine, your bleeding as well is going well, because not only are you still going to bleed vaginally after a C-section, you don't get out of the vaginal bleeding that occurs after birth because
such a misnomer.
I know so many people are like, when we posted that pericare reel, everyone was like, well, will I even need this after a C-section? Yes, because the vaginal bleeding is not from, like, a little bit is from the trauma that occurs to the actual vagina and like tears and stuff like that. But it's mostly from the wound within your uterus where the placenta was embedded. And when that placenta comes out, that wound inside of that uterus has to slowly heal. And that takes like 4 to 6 weeks for it to slowly heal and work through all of the stages of healing. So you're still going to have that vaginal bleeding, but you have also this incision that we don't really want to bleed very often. Like maybe a little bit of bleeding is usually normal within the first couple of hours, but after that, it really should not be bleeding from your incision at all. And if you are, that's usually a sign that something is going on. But we also still need to assess your fundus to make sure that it is firm, because you don't want your fundus, your uterus to be like relaxed and not firm, because that means that it's not only is this incision potentially now going to be bleeding, but also like where that uterus was embedded. So that's an increased risk of postpartum hemorrhage as well, just after C-section in general. The bleeding postpartum is also a little bit higher, just normally after surgery to be expected, but also from like all of the layers and the uterus on everything else so we're monitoring the bleeding a lot closer after a C-section than a vaginal birth. We're also measuring, obviously, like pulse ox, so oxygen levels within our bodies, because the medication that they gave you during the C-section could affect your ability to oxygenate afterwards. So we're just measuring a lot of things a lot closer, as well as the ability of your body to move, because after a C-section, you're numb a little bit higher than you would be for an epidural. So it can take like 2 to 3 hours for some people to fully feel all of their body. And we don't normally want to move someone out of that post-anesthesia care unit until they can either like lift their butt up comfortably, or they're at least able to move their legs somewhat, depending on the person. And then obviously pain might be a little bit higher after a C-section, and that's probably the one thing that people are most fearful of, is after that numbing wears off, is now you have this incision that's going to be causing a little bit more pain. So we want to make sure that once you're no longer numb, you're not having a ton of pain that isn't manageable with the medication that they prescribed. Like if you need extra medications, we're giving it to you in that post-anesthesia care area. After that, we do transfer usually to the postpartum unit. Whether your hospital, it's like, again, you just go to the unit you were in before in the same room, or you go to an actual postpartum designated unit. And that's where you usually will stay for around 48 to 96 hours, hospital dependent. Some people keep you there for 4 hours, even if nothing's going wrong, just to monitor since you've had surgery. And some people, it's like 2 days and you're like, oh, you're probably fine. It's person dependent on what you would prefer. Some people would rather be in a hospital for longer after surgery, so you have that help from like the nursing staff. But I know some people are like, please just get me out of this hospital. 2 days is long enough. And I know you probably stayed for about 2 days. And
Plus whatever the labor.
plus whatever labor is, yeah. But like postpartum, after birth, at least 48 hours, most people will stay after a C-section because usually that incision is covered by a dressing. They don't take that off for 24 hours. And then they take it off and then they want to monitor it again for 24 hours and then make sure you're not developing infections or able to walk around. Some hospitals, I'm learning, after C-sections, they don't get everybody up after like as quickly as they possibly can, which is different for me because most hospitals, all the hospitals, intentionally they like leave people in their beds for like 24 hours, some of them, and they'll have like their epidural infusing, which doesn't seem intuitive to me because I know all of the research of like getting up and moving is so beneficial. So all hospitals that I've worked at, we try to get C-sections up 6 to 8 hours post C-section, like birth time. So 6 to 8 hours, depending on if they had extra time in the OR, will like delay it, but they need to be able to like get up and move on their own to the bathroom like pretty comfortably with assistance, of course, and then do a couple laps around the hospital unit in order for us to take out their Foley catheter, because during surgery you have an indwelling Foley catheter to like drain your bladder, and most people for vaginal births that's taken out if you had an epidural before you had a baby, and it's not normally placed back. But for a C-section, once your legs are numb, you start to feel that Foley catheter, and it's not super comfortable. I've not had it personally, but I've had many, many people tell me that they would really like it to take it out. So if you're not getting someone out of the bed
I'm like, I promise I will. I will do whatever. I will run laps around here.
Yeah,
just take it
and
out,
that's
please.
what they're like. Can I please just get up because I want this to come out.
Yeah.
So we get them out at 6 to 8 hours. It helps so much with pain long term as well, but they want to get that Foley catheter taken out, and they're like, I will get up to go to the bathroom. Like, I don't care. Like, just take it out.
For sure.
But the worst is like when you take it out and then they're not able to pee for like 6 to 8 hours, and then you have to put it back in, and I feel awful. But most people are able to pee. But we have to make sure that they're able to get up and walk and not pass out, because again, C-sections have higher rates of bleeding, so they have a higher rate of potentially passing out the first couple times they get up. And I don't like it when my patients pass out and fall. So it's a lot of extra paperwork, as well as now like I have to attend to someone that has passed out. And that's not ideal for me, especially when it's on the toilet. It's not comfortable for a lot of people. So we make sure that they're able to do that pretty comfortably. And every hospital has a different length of time, distance that they have to walk, but usually it's just like at least a little bit around the unit. And then the Foley catheter comes out, and then they're able to, after that, it's really just normal routine postpartum care, other than like additional vital signs. So your vital signs are checked more often. But other than that, it's just the occasional fundal exams and vital signs after that. So like the first 12 hours is like a lot. It's a lot. But then after that, it's like a little bit less.
Let's take a break from this week's episode to talk about our podcast sponsor, Needed. Needed is a nutrition company that specializes in the perinatal time frame. And so they're a company that Roxanne and I have both used to support our pregnancies, our postpartums, our conception phase. Our husbands use it. So it's a brand that we really love and trust, and we highly recommend to you.
And one of their products is that I've utilized in my postpartums, especially in some of my pregnancies, is their iron. And their iron is not included within their prenatal vitamin because not everybody needs to supplement with iron. But for somebody who has low iron or potentially had a postpartum hemorrhage or heavy bleeding during birth, an iron supplement can be really beneficial because an iron is a vital part and a vital ingredient within our blood cells. And if we do not have enough iron, we can't create all of the blood cells that we lost if we had heavy blood blood loss. So having an iron that's not within our prenatal vitamin, that we can adjust the dosage, that also readily absorbs into our body, it can be really beneficial. And I really needed iron for my postpartum period because it was separate from my prenatal, so I could take it at different times so that it was able to absorb within my diet a little bit easier to help support my postpartum healing. And if you want to try out Needed's iron or their prenatal or any of their products, you can use our code MamastePod to get 20% off your order.
So Casey, are there other reasons why walking shortly after birth is really beneficial? Because you would think if you just had major surgery, you should just rest and lay in bed for as long as possible. But there's obviously a lot of benefits to getting up and moving, even though it can be terrifying.
For sure.
Yes.
Yeah, and just to speak to that fear factor for sure, it is scary, and a lot of times, as you know, as a doula, C-sections aren't always planned, and so kind of psychologically wrapping your mind around oh, now I've had a major surgery that I maybe wasn't planning for. Yeah, it can be our instinct to rest, and that's something that I've been a PT for almost 20 years. It's something that I've seen time and again in the hospital. Oh, I just had a full knee replacement. I need to rest. And I do think that was kind of I don't know, I don't want to say an old wives' tale. I think it comes from a good place of love and nurture. But I mean, I think our grandmothers told us, well, my grandma didn't tell me to rest. She'd be get up, rub some dirt on it and go. But, I think it was well-meaning of you don't want to do anything to mess it up. But we know, strongly supported in research, that we can reduce our risk of blood clots that can happen in the legs, respiratory dysfunction, things like pneumonia, infections, blood clots in the lungs, things like that can be post-surgical complications, kind of as your body is in that panic phase of okay, this was a very organized and methodical surgery, but your body's what? Did I just get hit by a truck? Sound all the alarms. And so, yeah, movement after that is really important part of reducing those postpartum, not postpartum, but post-op complications. And then as well as just generally getting you to take deeper breaths, which is going to expand the lungs, which is going to help reduce that risk of pneumonia. One of the things that we see post-operatively, especially with narcotic pain medicine, which is really pretty common, is constipation. And, you don't want to be working hard to move your bowels when you have a fresh incision in the belly and everything hurts. And so, yeah, it is, movement is everything. I mean, it's everything that we need. And yeah, hopefully you have a good nurse or a good partner that can help you feel a little bit more confident in getting up. Getting to the side of the bed is Kilimanjaro. That is the mountain that you have to move to get from this very stoic, Abraham Lincoln reclined position in the bed to side of the bed. And so we teach that with log rolling, usually rolling onto your side, much like you do in pregnancy, trying not to pull up or to strain against the incision too much. We can splint it, hug a pillow, kind of roll onto your elbow, use your elbow to push up. But usually once you get to the edge of the bed, take a few breaths and let your whole system recalibrate. There is this a bit of okay, I feel like I could do this. I'm a whole person versus when you're just stuck in the bed and maybe mentally rehearsing what it would be like. What's it going to be like to walk? What's it going to be like to do all the stuff? Cause yeah, you have sticky leads all over you and, big sticky incision and
your belly's orange.
Yeah, things are a little weird. So yeah, movement can feel familiar. It can give you, for me, it always felt like it could give you a little bit of autonomy and command back over your body. You've been numb, you've been cut on, you really didn't have maybe as active of a birth experience as for what you were planning on if you're hoping for vaginal birth. So you're okay, I'm back in charge, which for the psyche, I feel is good because now you're tackling this new job as a mom. So yeah, I can't say enough about getting out of bed. It's everything.
So what would the walking recommendation look like? Because we're obviously going to have folks that are listening that will have an unplanned or maybe even a planned C-section that are all right, well, she told me to go walk, so I'm gonna go walk and
Right.
optimize my healing. Or
like, what are you doing in the parking lot? Like, she said,
Casey
Mom,
told me to walk, and I am walking. Like,
Yeah.
what would like walking look like? Because for us, when we're recommending for somebody who just had like a vaginal birth, which is different than having a C-section in regards to recovery, or unless you had a hemorrhage, and then it's probably close. Yeah, the same. I'm like, maybe don't go for super long walks until you're like 2 or 3 weeks postpartum. Like initially, just kind of move around your bed, around your house, like do some gentle mobility, but like we're not going for like a 5K.
Right.
So would that be similar for
So
cesarean
similar.
birth?
Yeah, similar. Like keep the boat in the dock at first. So just sit on the edge of the bed. That's a big one at first. Keep somebody nearby. Make sure the bed is locked always, right? That's like a tricky one in the hospital.
Position.
Lowest
Locked.
position. Get your feet on the floor. I like to have like the little bassinet with the baby kind of there. It's just like a I don't know, a little oxytocin, little distraction, and just maybe stand at the edge of the bed, couple little mini squats, and then just take in what that feels like to have these hemodynamic changes, like the way that your blood changes from laying down, sitting up, standing up, especially postoperatively. And then just see kind of what your body does. Because if you start to get the sweats and you're like, I feel dizzy, sit back down, and most likely it'll go away. But stand, and then when you feel safe, maybe walk just around the bed, like we're holding onto the bed, and then maybe a bathroom trip, and then eventually like into the halls. But so I mean, I would say frequency over distance would be more optimized. I mean, get up when you can, for sure. But I think the longer that we sit post C-section, the stickier and trickier and more achy and uncomfortable it is to get up. So more frequently, let's say like on the hour, every 90 minutes or so.
And then probably like a slow pace.
Yep.
Gentle. Don't go for a 5K.
Slow pace.
Please do not go run a 5K at a week postpartum.
Slow pace. Yeah, working more on upright, especially when you're just standing upright. I've shared with women post C-section to do like some standing with their back to the wall, just to kind of really calibrate, like, oh, that is upright. Like they're like, stand up. I am standing up. And like, if you have the wall there, you can kind of, use your back muscles to help open everything up. Big deep breaths to open everything up, and that can feel like a 5K, honestly. Just navigating, like, there's just a post-op fatigue that is kind of indescribable if you've never had surgery, and it can catch people off guard. I think it's a lot like first trimester fatigue, where you're like, have I gotten this out of shape already? Like, what happened overnight? But yeah, not a 5K. Not a 5K for sure.
So how could someone then, like when they get home or maybe while they're still in the hospital, begin to approach like the actual incision and the scar? Because that's a huge aspect of C-section recovery that is sometimes overlooked. Maybe there's no guidance given at all. I know that there's no guidance about perineal massage, like scar mobilization.
For sure. Yeah.
Like perineal massage, like the prenatal one, there's all sorts of guidance out there, but there's nothing about perineal scar mobilization if you've had a tear. It was just like, well, you gave birth. Good job. 6 weeks. Like, there's no guidance on it. Like, Roxanne hardly got any guidance on like what to do after a hemorrhage, and you knew.
I knew what to do,
Right.
But
But like, we've had a lot of people that come on the podcast and share their birth story where they're explaining all the symptoms that they were feeling postpartum, and we're like, you had a hemorrhage.
Yeah.
Like, that's why you felt like that. So what could somebody do to help like begin that process of supporting their scar, like after a cesarean birth? Like, when would that timeline kind of start? Because some folks are scared to touch it. Like, there's a lot of emotion involved with it. Like, they're not
just looking at it.
Right.
Like, what would your general recommendation be?
So exactly what you're saying is like, get to know your scar, and get to kind of integrate, like, those are the very baby steps of just integrating your experience, that like, yes, this is my story. This is my birth story. And, try to stay relatively judgment-free about that, because I would say, normal is a weird word to use for anything, because like there's just such a variation in experience. But I think it's normal to be like, whoa, that's not how I thought that was going to go. And as mothers, like we're mothers to 8 kids. I think we can both, or all 3 of us, say like, whoa, that's That's not how I thought that was going to go. And it's beautiful and it's, right. And it's good, but it's like not always how we thought. And I feel like sometimes birth experience is the very first step of that, but getting to know your scar. Oftentimes you can take a shower within those first 24 hours. That was my experience both times, and I had different surgeons. But asking those questions, and depending on how confident your nurse is, sometimes like you had mentioned, like nurses might be intimidated about getting you up, or like, I definitely got like some looks when I was like, can I get up and get in the shower? And they were like, we don't have a shower chair. I'm like, no, I feel fine. Like, I know I feel like I can do this. I feel like it would just feel so much better if I could take a shower. So just those initial stages of like taking the bandage off when you're allowed to get it wet. Maybe some gentle soap and water if you're allowed to. Just I wouldn't say like fully rub your hands all over it, because we don't want to introduce anything external that could cause infection in those early days, especially the first like week to 10 days. But just taking a look at it and just noticing what it looks like. One of the things I was thinking about when you were sharing earlier about the immediate postpartum is that the surgeons have gotten so streamlined with these procedures that the incision, like if you ask probably our mothers or grandmothers, the incision was like much more aggressive and much larger back in the day. And it was like this, very obvious if you saw somebody at the beach, like, holy cow, that's a major, like, is that a surgery? Is it a shark bite? Like, it's huge. And now with these minimally invasive,
So small.
it's not a great indicator of what is going on inside or what has happened inside. And sometimes I think it's good to hear that like, yeah, that's pretty. It's a nice small incision and it might look good, or it's low profile. It'll be below the bikini. But it was a major construction site. Like a lot happened in there, and there's a lot of layers, and, it is very much like a tip of the iceberg type of a thing. So sometimes just knowing that tiny incision is there and it's closed and it looks good, like that can be enough for step one. In the webinar, I usually say like, your doctors just want to see that your incision is not open to the public anymore. And that is our first priority as hospital staff. Like infection, we're fighting off infection. We want it to be closed, clean, dry, intact. But when we get into scar mobilization, we're really talking about after that skin is healed and they say you're good or it looks good. Because I've had several clients tell me that like, oh, the doctor said it looks good. Like, it does look good, but there's work to do and the layers beneath that. So, early feedback is just get to know your scar, start to look at it, start to clean it. You probably don't need any to buy any aggressive wound care supplies. I wouldn't expect. It's not going to be should not be a big bleeding wound, shouldn't be any drainage really, minimal. Just get to know it.
So we'll get folks that'll message us where they are starting to touch their scar, like they're 6+ weeks postpartum, and they're like, but I feel like there's these bumps or these points not at my incision, like they're above by my belly button, or they're lower, or they're to the side, and so I think it's important to note that the incision site, it's not directly down,
right?
Yeah.
Is the rest of the cut. Like when our bellies are a lot bigger, they do the surgery. Sometimes it's a little bit more up, and the tissues that have the scar tissue on it are not always directly aligned with that incision site. So what we're mobilizing is going to be beyond just the external scar.
Totally. Yeah.
And I think sometimes folks don't realize that, where they're like, what do you mean?
Yeah. It's a very dynamic process, pregnancy, postpartum, scar mobilization. I think often of the video that you shared with the balloon where you demonstrate how the placenta moves. They're like, I have a low-lying placenta, and then inflate the uterus. Not inflate it, but the placenta moves up. And, this is really similar to what happens after C-section, that you've got this fully full uterus with baby in there, and you have an incision in a certain place, and then everything within the first 24 hours, we hope, the fundus goes back down and it shrinks back down to a deck of cards, like this amazing organ that's been so huge, and now it's here, and now it's buddied up with its new fresh big incision right on top of the bladder. And so scar mobilization can eventually, like post 12 weeks, involve some kind of deep poking and moving, and poking is probably not the best word, but moving things around, because that viscera, those organs have moved. And yeah, you can feel things in lots of different places, especially because each layer was opened, and some layers, are closed with internal stitches. Yeah, a lot going on.
So what is the goal of scar mobilization? Why should we even bother doing it?
Yeah, that's a good question, because there are a lot of good-looking scars that if we put hands on and started to move and see how the tissues are moving, we would find out that there are quite a few adhesions in there. So the main goal is to get the 7 layers of tissue to either stay unstuck from one another or get unstuck. If it's like later on, like if you're listening to this and you're like, I'm 3 years postpartum, or my kid started kindergarten, like, can I still do this? Yes, you can. And we can make changes with scar mobilization long after. But so the goal is that we have skin, fat, fascia, muscle, uterus, peritoneal cavity, and that we want those all to be, I was going to say like cousins. Like we want them to be cousins and stay cousins, because they are adjacent. They're separate entities. And they're not really supposed to be attached. Just like that's really the definition of an adhesion is any time that we have 2 tissues in the body that they're not intended to be attached. And so, yeah, that's the goal, is to get those tissues moving apart from one another.
So we'll get folks that'll message us and they'll be like, oh, like I'm having so much back pain, or like, what exercises can I do? And usually one of the first questions I'll ask is like, what type of birth did you have? And they're like, oh, I had a C-section. And I'm like, have you ever done scar mobilization? And they're like, I'm not talking about my C-section.
Yeah, my belly feels fine.
I'm talking about my back.
Yeah.
Like, stay on topic, woman. and I'll be like, well, in case you didn't know, like, our fascial layers are kind of like connected throughout our body. Like we have all these slings that are kind of going through different places. And so when I do movement with my arm, like there's movement happening through the fascial layers down through my leg. And if you're feeling like tightness or restriction in your low back, it could be related to this wrapping around to the C-section incision. So there might be some adhesions there that are not allowing your body to like pull into a different position. And that's what might be causing some of that lower back pain. They're like, oh, okay, I guess you were replying correctly to me then.
Yeah.
But it's crazy how
That's like mind-blowing to a lot of people.
It is. Or lack thereof at a C-section scar can impact so many other places within our body, and ensuring that those layers, I mean, this is like a transition point in our body. Like we've got one on the front and one on the back of our body with these myofascial slings, and this is like a key place
for sure,
where we're transferring movement from our upper to lower body. And we have an incision there, and if everything's kind of stuck at that point, it would make sense that moving in other places in our body, we're going to have trouble with it. So, like, what other, like, signs or symptoms can somebody, like, notice that they're like, maybe I want to mobilize my scar? And this could apply really to, like, or maybe not any.
A lot of
surgeries. Like we talk about the 3 big ones before I weigh in. You just made me think of this. And I wanted to share it. Something also that we talk about in the C-section course is like t-shirt fashion. And so if you think of like a button-down shirt that's tucked in, a front tuck, notice what would happen when you raise your arms up and that shirt kind of comes untucked. If you stitched your shirt to your pants and then tried to raise your arms, like it would create this restriction of like, okay, I can't go any further. I'm kind of stuck down there. And that's really similar to what is happening in our fascial layer. Same thing with if you knotted, like if I knotted my shirt in the front, it's going to pull fabric from the back. And so like Gina was talking about that kind of stitching down of the front, it's got to come from somewhere. And so back pain is a really, really big hallmark for women post-cesarean. And I'll say this so that like I feel like I'm generally like this is my career. I've been in physical therapy for so long. Like I understand the mechanics, and yet I didn't realize, excuse me, that I had back pain until I got rid of it. Like there was just this nagging ache. And that I think is I don't want to say universal experience, but it can be really common that they're like, oh, I just thought I was like always going to have back pain.
I just thought it was.
I thought this experience.
Yeah.
I thought this was just normal. Everyone had
Right.
this.
Which, we we don't always do a great job in like affirming mothers, like, oh, welcome to motherhood. Like your back's just going to hurt now and like whatever. But, and the back pain, there are different reasons for that. Like adhesions are one, and just the brain having a hard time reconnecting to the abdominal muscles. That's another one, that could cause back pain, that we just don't have that stabilization, that kind of dynamic system that we need. And the brain's kind of freaking out a little bit, like, what is going on here? Like, where is our coordination? So that's a big one. Another big one that's super surprising to people is pain with penetration. And so it's something that, again, another misnomer, like you're not going to bleed after a cesarean. Yes, you are. And that, hey, you're good. Like you're preserved. Sex isn't going to be painful for you. And that's just not necessarily true. There are lots of women with post-cesarean that end up with pain with sex, specifically with deep penetration. And it's the way our anatomy is arranged and the way that the uterus kind of hugs back in on the bladder when it goes down to size, and that if there's some attachment there, some adhesions, penetration can be painful, and scar mobilization can really help with that. And it's external scar mobilization kind of coming from the front. It's not an internal thing typically. And the last one is bladder frequency or urinary frequency, feeling like you have to pee all the time. And that can be just tied into that like bladder adhesion kind of thing, that we could have some deep adhesions and you kind of feel like your bladder fills, and you're like, I gotta go. And you just went 30 minutes ago, or maybe you're just peeing a quick little stream. Yeah, those can be signs that you wouldn't necessarily connect to like a cesarean. Yeah, it's confusing. Like my stomach doesn't hurt, or no, my incision, it feels fine. It's a little weird, but no, it's fine. And yet it's kind of wreaking havoc
Internally.
Yeah, internally.
Yeah. I do hear that as one of the myths of like, oh, I'm getting a C-section to like save my pelvic floor.
Right.
So I don't have issues. Because like, we'll sometimes hear it from folks that have had like either really severe tears in previous births, or they're really scared because they've had like a prolapse in a previous postpartum, and they're like, I don't want to make it worse, so I think I'm just going to get a C-section. Like the pelvic
a valid
floor,
choice.
which is
Totally
like,
valid.
and I think that's fine. But if the thought is I'm going to do it to avoid pelvic floor issues, that's not accurate.
Yeah, let it come from information.
If it's from like, I would rather have like a controlled C-section surgery as opposed to like the potential of having another third or fourth degree tear, like that's different. If it's to, I want to ensure that I have no pelvic floor issues, is not accurate.
Right.
Because a lot of the pelvic floor dysfunction that we have postpartum is related to pregnancy and working through pregnancy for 10 months with an additional load, altered biomechanics, like different stabilization patterns. And then we give birth, and it, like we talked about before, like where that incision is a key junction for stabilization for us. And so that's going to affect how our pelvic floor can function, how our bladder is functioning.
Kind of a double whammy with C-section, because it's like you're going into surgery. We always teach like if you're having a planned surgery like a knee replacement or hip replacement, like train up. Like insurance is very supportive of pre-physical therapy, that kind of thing, to get stronger. I'm like, that's not really, I want to choose my words carefully because I don't think that we're at a deficit when we're pregnant, but we may not be firing in the same ways that we're going to ask our body to fire our muscles when we're postpartum. We're kind of firing around the baby and hopefully not too compensated ways, but modified so.
I mean, there are postural changes that happen during pregnancy.
It's
like
harder to prehab.
Changing
pregnancy.
biomechanically. I mean, you can absolutely work out throughout your pregnancy in support of the postpartum to help with the postpartum. And we talk about like movements that you can do prenatally to not only support like healing postpartum, but specifically to help with that neuromuscular connection postpartum or post C-section with that anterior oblique sling, which is the sling from kind of your chest, obliques, crosses where that incision is to the opposite adductor or inner thigh. And having that kind of movement pattern accessible to you and like something that is already kind of connected in your mind prenatally can help you postpartum. But again, we're going through a whole like huge change in our body, the amount of weight that we have on us, like, or how we're stabilizing, how we move our body. There's a whole bunch of stuff that's
by the way, like,
is hard in general, but like
hormonal
throwing on
changes.
like
sleep deprivation.
also a new baby.
yeah,
Right.
like
Shift in focus, right? Like pregnancy.
Most people don't get a knee surgery because they get given a puppy.
Right.
yeah, like,
Yeah, exactly. Can you
Yeah.
imagine? I mean, it's
Like, congrats, here is your puppy.
also
Yeah.
take care of this and don't climb stairs.
but also don't like every 2 hours I'm gonna come in and wake you up.
Your puppy's gonna
right, you need to rest.
Like
But also don't.
yeah,
You can't. Yeah, it's a lot. There's a lot going on there, and it's not. I think what is important to me to share is that it is so normal, though, in what we see post-surgically elsewhere in the body. Like you could have, let's say, someone who tore their ACL and maybe chose for a while not to have surgery. You could be totally functional and walk around and do stairs and like move through life. And you can go into surgery perfectly functional and come out and feel like your quad is just dead, like dead asleep. You can't make a contraction. And we know this. We see this in rehab. We put the electrodes on, like try to, get them firing, get them standing, doing things like that. And it's like we know that the body responds this way to surgery. And yet we leave women bewildered after C-section about like why they can't make a contraction in their abdomen, or why their breathing patterns are altered, or why it might be beneficial to work with people who are skilled in understanding that transition, or use programming, why it is different. Yeah, it's so different.
I think it was really common to see in the military, obviously worked with lots of active duty moms who had C-sections, and they're like, how is this going to affect my sit-ups?
Yes.
And so many of them after a C-section were not able to do sit-ups the same as they were prior to, because that connection was lost. And the Army's PT programs probably needs some revamping depending on the unit you're in. So they're not rehabbing that C-section area in probably the most optimal way. And they're just not able to engage to be able to do a sit-up in that 2-minute time period because of that. And it's not like it was everyone that was having a baby. It was just specifically C-sections were unable to do sit-ups.
It's a private-ish area. So it's like if you had a big old brace on your elbow, I feel like there's something to be said there for the symbol of it, and she's over there rehabbing her, she needs to take it slow because she's got that big brace on her elbow or her knee or something. But we've got these bellies that, we learn are aesthetically pleasing to people when there's a baby inside, but then quick cover it up. And so, there's people move differently, or they're struggling to try to, do things the same way. It doesn't feel the same. That's a pretty universal thing where it just doesn't feel the same. And because you lived it with me in the programming, but that the oblique sling, the connecting of the brain and creating the demand to get the oblique sling firing, it's everything. It's puts your brain in control over the system again, and
they're being patient with the process is so hard.
So
And obviously share if I'm misunderstanding or misguessing what this experience is like. Because when I think back to my first birth, I didn't have a C-section, but it was not what I was planning. It was not what I had envisioned and was preparing for myself. Yeah. And so when I entered my postpartum, it was okay, well, now I'm going to do all the things right. Now I'm going to crush it, because I obviously failed at that. So this is what I am going to dominate.
Right.
And fortunately, I had some sense in myself to take my time with my
which is very
unlike myself. Something awoke in me, I guess, when I gave
truly,
birth.
I got it from you. I was what?
I was what do you mean?
We're not just gonna kill it.
But we'll have folks
We're not box
that'll
jumping
email us doing our C-section program, and they'll be like, this is too easy. I need to do more. And I wonder if
Like, can you move me like just like a couple
10
weeks
ahead? Like,
and I'm like,
you're
no.
2 weeks
Go
postpartum.
back and look at my Instagram 7 years ago, that post I made. I was just terrified. I was like, she's going to have me doing, it's box jumps because in my mind, like, it's what we need to do. Like, let's not start light. Like, let's go. It's been 6 weeks. Like, let's go.
And so I wonder if there's this like desire inside, because I felt like I had something that was similar, that was like, I'm going to redeem
Yeah.
my birth with my postpartum recovery to where it's going to look like nothing happened. Like that, I'm going to erase everything that happened during my birth with this recovery and rushing the process. And what we normally find with our clients, especially our C-section clients that really rush, is they have to start over like 4 or 5 months down the road. And they're like, why am I not, like, I'm leaking, like, I'm not hitting my PRs like I feel like I should, like, I'm not back to where I thought I would be, but I'm crushing my workouts. And it's because they didn't take the time at the beginning to focus on reconnecting with their new body.
Remember way back in the day too, like I was like, could not get over the deadlift hump. And like Baron was trying to help me the one day and I was just like, this feels like Invasion of the Body Snatchers. Like, I don't even know whose body this is. My back is hurting. And like, I can't fire. It'd be like, mysteriously waking up one day, like you were a great dancer and the next day you can't dance. It's like, it was like these fundamental coordination patterns, that are just like gone. But, sorry, to what you had said. Yeah, there was, I think it could be internal of like, I'm going to crush it because that didn't go how I want. But I also think, and I feel like we're a really good voice in the noise for this, and I feel really good about that, but is that there's this, it can be kind of bewildering because maybe if no one knows what to say, there might not be this voice of like, you had major surgery, so like you needed this is your path, and like you are going to rehab, but you got to do these things first. Like it can almost feel like another punishment. And you're like, well, I didn't keep up with the vaginal birthers. Like, I better keep up now. Maybe because it's like, well, we're all moms. And I would say probably like our generation is the first generation to even say how we birth. Like, but my mom still says that to me. She's like, I don't know how I was born. Like, I was assuming, but that wasn't something that people talked about. And so, just not even knowing really that you need to take it slower, kind of understanding why, or I think even understanding that we're laying the foundation with some of the scar mobilization things for healthy organ function. So whether you're going to have 6 more kids after that, and you want your uterus to be able to freely expand and then contract back down with those pregnancies, or, you just want bladder and abdominal health from now until, eternity. Like, I think that those are important things that are kind of missed in that race to like get your abs back or something. And I don't think there are really great established timelines maybe of like what to expect. Like, okay, I'm behind a vaginal birth, but how far? How much?
I feel it's so varied from person to person, even with the same type of birth. So like Roxanne and I both had an unmedicated, almost no intervention outside of your saline lock and
one IV
fluids. Like, but if we stacked the deck of like our stats for
relatively,
they're pretty much the same.
Yeah.
Like her baby was a little bigger than mine.
a lot bigger, a little bit,
maybe a pound bigger, but like her recovery postpartum was significantly different than mine. Like I'm over here like laying in bed, like holding my baby, making Instagram posts, and Roxanne was like, I'm trying to not pass out when I stand up to go pee.
Yeah.
And so we had a very similar birth experience, but our postpartum was incredibly different. And so that timeline right there is drastically so different. Like when you have a postpartum hemorrhage, like how you're going to recover postpartum is going to be very different than somebody who did not.
You're gonna nap a lot.
And then like labored C-section versus planned C-section. I don't have the experience of a planned C-section. I have a little, wish that I did, because like just seeing it from the other side, I'm like, oh no, like I was in pain. I was exhausted just going into surgery.
Yeah. There's a huge difference postpartum. that I've seen of like people who had their scheduled C-sections just the first day postpartum versus people who were labored and then went to an unplanned C-section. Just that first day is completely different.
Right.
But it's also wild with C-sections because we'll have the repeat C-sections that are scheduled, and some of them are like the smoothest C-section, like really quick, easy, in and out within like 30, 45 minutes.
Yeah.
And then you have repeat C-sections where they're in there for a really long period of time because all of those adhesions are in there even after one C-section.
Yes.
And all those adhesions affect not just your function like during your daily life, but it affects your next C-section as well. If you have just your next birth in general, probably, whether you go for a VBAC or if you have that repeat C-section, it affects like the length and your recovery, because if they're having to like break up some adhesions just to get through the layers to the baby, then that's going to be a lot more discomfort in the postpartum. And so we'll have people who had a bunch of adhesions during their surgery, which increases your risk of injury to all of your surrounding organs as well. Like they would have to call in like urologists as well if like the bladder was really adhesed to the uterus, because like you don't want to like cut a hole in the bladder in the middle of surgery.
It can happen,
or like the bowels as well. Like they would have to call like I can't remember the name, but those people in to make sure that like they're separating all of these organs appropriately. Yeah. And then your recovery from all of that like manipulation just to get to your baby is so much harder. Like they would have so much more abdominal pain postpartum because of all of those adhesions.
And even prenatally too, have seen it almost mimicking like round ligament pain, which I mean, who's to say if it's round ligament pain or not, but or adhesion pain, but just that like your uterus is like trying to get it going, trying to expand, and it's stuck down, like hot air balloon tethers, but more stickiness. And we don't have control over how we make scars, like just like you were saying, births are different. Like if you look at your chickenpox scars or this or that, scars on your knees, like we're going to be different. And some people do just by nature have hypertrophic, like extra collagen in their scars. But really, like there's very few people who wouldn't benefit. I would say like
it was very rare.
It's very rare. I would say if someone had like a bleeding disorder where deep touch could potentially be dangerous or trigger like a bleeding response, that would be one of the situations where you'd have to be careful and mindful of scar mobilization. But it's a very simple technique. It's pretty. You could do it yourself. You could do it at home. Partner do it.
And you can have so many benefits.
Payoff, right? So we have to look deeper than the scar, I think, is really the message, that it's like could be a really beautifully healed, make the surgeon happy type of a tiny scar, low profile, and still have havoc wreaking down below. Not in a scary way, but just a way that you can feel better, and you realize how much better you feel when you get in there and move stuff around.
Yeah, and someone can work with a physical therapist as well to do scar mobilization, especially if they're like, I cannot touch this. Like it's not going to happen. Like they can work with a professional that can help kind of walk them through it. And sometimes somebody else touching it can allow you to do the mobilization for all those benefits. And you can also use like different tools. So we have a friend that was using like laser therapy with like the
red light.
Red light.
Yeah, we talk about
that. Which I thought was pretty neat. You can use like cupping massage like on
just
it.
Lots of things.
I've heard of PTs doing like dry needling, which needles just in general.
Yeah, and needles, abdominal needles I mean, depends on sometimes what we see just like in any other areas, like if you have a compensated pattern, like my rectus abdominis was sore for nearly years, like a couple years probably, where I'd be like, oh God, why is it still so tender? But when certain muscles are firing to do the job of other muscles, like oftentimes I think with vaginal birth, we find it with overactive groin muscles, where your groin is doing the work of your pelvic floor, and you're like, they're like, we're here. We're here
for you. Hold it on, like your adductors and
just don't ask us to let go, because like we're, and the body's brilliant and will compensate, and that's not a bad thing. It's just that, like I think that you could feel better
So do you have any last bit of advice for somebody? I know there's probably so much that you could go back and talk to Casey, like holding Bodhi, like any like sage advice that you have for somebody that maybe just like either just got told that like their recommendation is to have a cesarean or just got out of one and they're like, okay, what do I do now? Like, how do I make this all better for myself?
I think for me over time, just learning, accepting, and understanding that there's just not one best way, and that a cesarean can be a great way to birth. And like scars aside, this is just something that we want you to feel better and to function better and to be armed with the knowledge. But it can still be like a super beautiful and connected birth. And it's not that vaginal birth is unscathed. It's just a different set of healing. It's just a different set of healing. And yeah, I think it's, we're lucky it's an option, but not so lucky that we can dismiss it like, oh, you're just lucky, like healthy mom, healthy baby. That's all that matters. Like
That's the bare minimum.
I think I say, I would tell her, me 6 years ago,
That's almost 7 years.
almost 7 years, just work through your process. And when you're not okay with it, it's okay. It's okay to not be okay with it, because someday you'll feel okay about it and better about it. And ultimately that kind of led me here. So it was just a part of my story I didn't realize. So I'm happy to be here. Yeah.
Well, glad you're here.
Yeah, I am too.
So if you want to learn more from Casey, she teaches our C-section scar mobilization webinar that we offer every few months. It's a live webinar with her for about 90 minutes. I think we've got it down to 90 minutes.
Maybe 95 sometimes.
Casey talks about like how to actually approach mobilizing your scar, like different techniques that you can do from her experience as a PT and then also a C-section mom of 2. In addition to the emotional aspect of recovering from a C-section, because it's not all just do these physical things and you'll be fine. Like, we also need to understand how important our mental healing and like the psyche is in regards to our healing postpartum as well, especially if it was a birth that you were not expecting.
Totally.
If you don't want to watch a live webinar and connect with us in that way, we do have a self-paced course as well that does include some mobility flows, which are like really wonderful ways to begin to move your body. And then if you're really early postpartum, like you're like a day or two after your birth, I would say like any earlier than that is probably not necessary. We do have a free early postpartum recovery course that does have some C-section modifications in it with as well, which is just gentle breathing, mobility, and like a gentle guide to movement within the first like about 4 to 6 weeks postpartum, because 4 to 6 weeks is too long to do nothing. But it's also too short to jump back to the gym. So
don't do box jumps.
Won't be box jumps and wins.
We normally recommend if you do want to return to structured fitness around the 6 to 10 week mark, which is a really big time frame because like we talked about before, all of our healing is really unique postpartum, like whether you had a vaginal birth, whether you had a C-section. And so it's just really important to give yourself some grace and kind of honor the process as hard as it is.
We talk about that a lot in the C-section course too, is mapping out a timeline of the kind of cellular healing and what's actually going on so that you can feel confident in approaching scar mobilization and kind of when to touch and when it wouldn't be so safe and what to look for so that can be a little bit more empowering.
And then if you want more movement stuff from Casey, she does teach our prenatal yoga and our postnatal yoga courses as well, which I should start doing more on my own. Also, Roxanne, you should probably do some postnatal.
Probably.
She has a really good like jaw release.
Oh, yeah.
That one's good.
That one's
my
Myofascial release for motherhood.
That one alone is worth the $49 course. So thank you so much, Casey, for being our OG mom, a part of MamasteFit, and being my postpartum buddy from days. I guess you were day 7 and I was day 1. I was
day
really
1.
trying
Gina's
to
day 1.
my baby on time.
Like, I think I'm gonna buy an espresso machine at 2 a.m. You should do it.
Yeah. It's like, oh man. It's like what other Amazon purchases have I made thanks to Casey influencing me at 3 a.m. It's like, are we allowed to do this? But thanks so much for being a part of MamasteFit and for taking the time to chat with our listeners.
Thank you. Happy to.
So if you enjoy this episode, be sure to like and subscribe to our channel so you get notified whenever we release new podcast episodes. We release new educational episodes like this every Wednesday, and then new birth stories on Fridays. Just about 2 times a month, so will be the first and the third Friday of every month. If you're pregnant and you're looking for more support throughout your pregnancy, you can join our online prenatal fitness programs and online childbirth education course. Our prenatal fitness program is not only designed to help you prepare both for a vaginal birth and a cesarean birth, but also to help you stay strong and pain-free throughout your pregnancy. Because there's 10 months that we're moving our body that we do not need to be in pain, and we can be comfortable as we move our body. But it can be really hard to know what you can even do. And so we guide you through that with our prenatal fitness programs. With our childbirth education course, what we found has really contributed towards a positive birth experience is not whether you've had a vaginal or a C-section, but rather that you felt empowered and confident during your entire birth experience. And the way to do that is to know your options so that you can make informed decisions that work best for you and for your family, regardless of what other people may choose. And so it's really important to us that you feel that the decisions that you make are made judgment-free from us. So you can check out our online courses at MamasteFit.com. If you're postpartum and you're looking for more support after your birth, we do have C-section specific recovery programs that include our scar mobilization course with the live webinar. So if you want to watch a self-paced, you can, but you can also join Casey live with the webinar. In addition to our C-section recovery course, our pro fitness program that Casey and I developed together after her, I think it was your second birth that we did, where she yelled at me and told me that her recovery is different than mine. And I finally accepted that it's okay to acknowledge that it's different. And so we developed a specific program to help you recover postpartum based on what we discovered really helps folks reconnect after birth. So you can check out our C-section program on our website as well. You can check out all of our courses on our website at MamasteFit.com and use code STORY10 to get 10% off any of our online offerings.
This podcast is sponsored by Needed, a nutrition company focused on the perinatal timeframe that both Gina and I have utilized during our pregnancies, and even our husbands have used it. And you can use code MamastePod to get 20% off your own order to get your own prenatal and postpartum support.